Now let me congratulate Indonesia being elected as the chair of the 4th session of the Islamic Conference of Health Ministers and other members of the Bureau. I welcome Your Excellency Dr. Nafsiah Mboi, Minister of Health of Indonesia.
Your Excellency Mr. Eric, Vice Minister of Health of the Republic of Kazakhstan, Chair of the 3rd Islamic Conference of Health Ministers, Ambassador Mboi, Assistant Secretary General of the Organization of Islamic Coorperation, representatives of international organizations, distinguished delegates, ladies and gentlemen, a very good morning to you all. First of all, allow me to extend my warmest welcome to all of you as distinguished delegates in this important 4th session of the Islamic Conference of Health Ministers in Jakarta. I hope that you have been able to recuperate from the long flights so many of you had coming from your respective countries. I also thank Your Excellency, the Assistant Secretary General, for his inspiring speech this morning. Indonesia is honored to host this conference at a time when the OIC member states, together with the other members of the international community, are jointly working to address so many important challenges we face as we improve the health of our people. I wish to thank all delegates for entrusting to me the chair of the 4th session of the Islamic Conference of Health Ministers of the OIC member states. Let me also, on behalf of the government of Indonesia, extend our thanks to the government of Kazakhstan, which held the chair of the ICHM prior to Indonesia. Our appreciation goes especially to Her Excellency Mrs. Coorperation the Minister of Health of Kazakhstan, represented on this occasion by His Excellency, the Vice Minister of Health of Kazakhstan. We are grateful for the stewardship shown by the Minister in advancing the common objectives of the Islamic Conference of Health Ministers for the past 2 years. Kazakhstan has led our cooperation in an outstanding way, heeding our strong sense of collective values and our aspirations for solidarity, which ensure the continued cohesion and relevance of ICHM in addressing health challenges in our respective countries. I am confident that with the strong spirit of Ukhuwah Islamiyah, the Islamic solidarity, we can make the most of our present meeting and work in harmony to overcoming health problems for the sake of the Ummah's welfare across the OIC member states. The challenges we are facing today require us to work hard to strengthen unity and health cooperation, thus assuring progress on our own national goals and targets, as well as intensifying our contribution to achievement of the global targets of the Millennium Development Goals. This effort will be a firm foundation for our work, shaping a new agenda as we continue our quest for equitable development beyond 2015. With this goal in mind, our 3-day meeting will focus discussion on the health of the people of the OIC member states, a continuation of deliberations in previous conferences in Kuala Lumpur, Tehran, and Astana in 2007, 2009, and 2011, respectively. During these conferences, we initiated the discussion to find ways to address several issues, such as maternal and child health, as well as broader issues, such as nutrition, communicable and non-communicable disease control. We also had discussion focused on various options for ensuring reliable supplies of good quality, effective, and affordable vaccines, which His Excellency the Ambassador, the ASG of the Secretariat, has so eloquently underscored. Overarching the various individual challenges related to health, we also consider the wide-reaching and important topic of health system strengthening. Excellencies, distinguished delegates, ladies and gentlemen, common effort in health is an important and well-recognized aspect of human development and poverty alleviation among the OIC member states. Without progress in the field of health, assuring the resilience and productivity of a people, other aspects of development are hampered. It is a field which needs to be pursued individually as well as through joint Islamic action. The OIC 10-year program of action provides guidance on cooperation amongst the OIC member states and emphasizes our concern with mother and child health as an issue of priority concern throughout our countries. I believe that our theme, better nutrition, better health, better ummah, can inspire and guide us in reaching the objectives of this conference with the goal of improving the health and wellness of the ummah. I am also certain that this biennial meeting will facilitate and strengthen multilateral cooperation among OIC member states in the field of health. Excellencies, distinguished delegates, ladies and gentlemen, in closing, again I would like to express gratitude and appreciation for the confidence expressed by the membership of the OIC in giving Indonesia the privilege of hosting this fourth session of ICHM. At the same time, let me underscore that it is imperative for us to continue working in concert if we are to ensure positive results of the 3 days meeting and reach significant progress in the field of health for our people thereafter. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.